Neurology Quiz number 39. What is autosomal dominant nocturnal frontal lobe epilepsy? This is an uncommon inherited form of epilepsy. 80% manifest in the first 2 decades of life, and mean age of onset is 10 years. However, onset can range from infancy to adulthood. Seizures arise in the frontal lobe during non-rapid eye movement sleep, usually stage 2. These are often stereotyped and brief, lasting 5 seconds to 5 minutes, and typically last about 30 seconds. They may be so short so as to simply manifest with paroxysmal arousal. In the most pronounced form, the seizures may be hypermotor, with vigorous movements of the extremities such as thrashing and kicking or bicycling, and there may be a mixture of hypermotor and tonic-dystonic manifestations. Episodic wandering may occur, which is mistaken for sleepwalking. Awareness may be retained during seizures, and the condition is often misdiagnosed as psychogenic non-epileptogenic seizures or as a sleep disorder. A minority of patients may experience daytime seizures as well. Clinical examination is usually normal and intellect is preserved, but there may be associated cognitive impairment and psychiatric comorbidity. It is a lifelong condition, but attacks may become milder and less frequent in middle age. Ictal EEG recordings may be normal or obscured by movement artifacts. Ictal rhythms, if present, are usually sharp waves or 8 to 11 Hz spikes. Interictal EEG abnormalities are infrequent. Video EEG shows clusters of seizures with a frontal semiology. The disorder is typically due to mutations in the neuronal nicotinic acetylcholine receptor. Inheritance is autosomal dominant. Most patients have an affected parent. Genes involved include CHRNA4, CHRNB2, CHRNA2, which code for the alpha and beta subunits of the receptor. Other genes implicated include KCNT1, which codes for a sodium-dependent potassium channel. These patients can have a more severe phenotype and are more likely to have cognitive and psychiatric abnormalities. Treatment with carbamazepine is very effective and is associated with remission in 70% of patients. However, if carbamazepine is not effective, other AEDs may be required. Some patients with a specific pathogenic variant of CHRNA4 have been reported to be most responsive to zonisamide.